This morning, having a conversation on the opportunity cost of financing, of debt financing, and provisions of healthcare services. We are joined actually in the studio this morning by the national coordinator of the National Taxpayers Association, Irene Otieno. Irene, good morning.
Morning.
Karibu sana and welcome to the show.
Asante.
Every time we hear taxpayers, we're just thinking KRA. But obviously this is different because and maybe then you can just now take it by the horns and explain to us what the association does and who here, when we're talking about taxpayers, are we referring to?
Thanks, and very delighted to be here this morning. Straight to the question you've pointed, and I think that's the perception we have as Kenyans. Most times you look at tax and the issues around tax and you're thinking carry, you're thinking, is everything in order with my tax books and everything like that? But we as an institution are trying to shift that and to let us understand that the taxpayers are essentially you and me as citizens. So looking at taxpayers closely related with being a citizen of the country where you are, so that then you're able to add your voice. So this is an institution that was established around 2006, and we focus a lot on building awareness of the citizens to the fact that they fund the government, all government operations, so that it doesn't look like the citizen is, there's a favor being done to the citizens, but rather you're funding the system, and hence you must have your voice on matters of policy, on matters of tax raising. How is the tax being raised, and again, how is the tax being used? So tax accountability, look at it throughout the cycle. Yeah.
You recently commissioned a report about the opportunity cost analysis of debt financing and provisions of healthcare services, and I think obviously there were very many interesting things that came out as a result of this. What were the alarm bells for you as you did this report that we then now go into discussing?
Before I address that, let me just, in terms of context and why we are here together also with Shiro. So as an institution, we are members of the Okoa Uchumi Coalition. So of course, that's a coalition that is concerned, a lot of civil society players, academia, media, that are concerned about debt. And we know there's been conversation as to whether the debt is a problem. Is it an issue? Is it not an issue? So the numbers, a lot of it has been about the numbers. So are we in the red or not? But we felt that for it to move from simply policymakers to also the citizens, then try to link the issue of debt with something that citizens feel daily. Remember, we are also within these issues around COVID-19. So we felt, why not look at health financing and whether debt has had an impact on the budget allocation to this sector, then correlate it and then say, hey, so debt is not an abstract issue, but it does affect your daily living. So the immediate one that I think about is the fact that first, when government, when we were looking at the tax measures that government put out during COVID-19, they clawed back, in essence, the limited provisions they'd given to citizens and individuals. You remember it was anyone with lower than Kenya shillings 24,000 as a monthly pay, then you do not pay tax. But they took that very fast. So they were like, hey, we are losing a lot of revenue. So we felt as an institution, when you look at health, there have been concerns throughout that a lot of Kenyans, are moving down to poverty because of out-of-pocket health payments. The government has not acted as fast and as sensitive as they are to a dip in their revenue. So that for us is a key issue, that government always looks at its issues. If it's revenue, they wouldn't let that state of affairs exist for long. But when you're looking at accountability issues, these take forever. So that is one key aspect that we felt. Within that time, remember, government was saying it had no capacity to provide for its citizens who are seeking healthcare related to COVID-19 ailments. NHIF was not supporting that. So then the question is, when we were even paying for NHIF as a citizen, where and when does that money come to assist you? And in case then the government says we are giving a safety net for a short period, where then the money that I save, I can be able to take care of my health my health needs, that again is being taken back very fast. So that again is what we are trying to have conversations with citizens to then say that the debt issue is reducing the capacity of this of a government to take care of its citizens, particularly a key issue that they've mentioned as UHC. As a pet project of our current government.
Okay. And so then from putting all this together, what were the key things that came out that stood out kind of like a sore thumb and said, hold on, we cannot be operating like this, from the study that you then did?
Looking again at the issues around the county and the devolved government, the report pointed to the fact that the devolved units were a bit silent. Remember, debt is solely a function of national government. So the devolved units have not a lot of voice on it, though this is something that the law doesn't close them to doing it. I think they haven't looked creatively at their roles within adding their voice to the debt conversation. But the net effect we felt was a lot of the COVID-19 impact was at those lower levels, at the county level. Their capacity is reduced to act very fast. But then their voice on matters of the debt conversation is a bit quiet. So again, the report for us was bringing an opportunity for us to discuss with policymakers. Should debt solely be the role of the national level, while it's a fast charge on the consolidated fund? So it means it takes money and reduces the capacity of the devolved units to respond to health disasters. A key one being this, where national government itself did not have the immediate statistics to respond as fast. So the people on the ground are the counties, but the debt issue is something that they are not fully aware of or taking ownership of, I would say.
Okay.
Yeah.
Can I add to that point that Irene is making about national government going out and procuring debt? Then spending it on services, including spending it on health services. And in fact, the brief we received about the study shows that indeed allocations to health have increased. So as debt increases, allocations to health have increased. So some of that money is coming into the health sector, but 65% of that stays at the national level and only 13.7% increase at the county level. Reinforcing what you're saying, that much as health is a function of the counties, when government borrows, it's not letting that money come down.
Trickle down.
So if we had gone ahead to maybe look at the impact on out of pocket, at the impact on access to health, we might now begin to see that this money isn't going to the right place. It's not really reaching the citizen. And the question becomes, where is it going? Where is this difference? This 65%. If government is borrowing, spending it at the national level, health, does it mean that referral services have improved a lot? Maybe Kenyatta Hospital has really improved its services. Maybe it's all going there. Or there are asymmetries. So government is borrowing and maybe is not fully accountable. Maybe there's waste. So actually maybe there's a bit more. I don't know whether the study looked at this difference.
The study did not look at, there are limitations to the study. So that was one. We were not able within the time frame to look at that. But the other key issue that you've mentioned, Shiro, is, as you say, 65% is held. What we need to query further, which is something we are again picking as an institution, is where is this 65 going? We look at the issues of recurrent versus development. Again, you look at operations. You look at how the Ministry of Health budget looks like. There's the operations, there's again development, there's recurrent. But a key concern that is not unique to the health sector only is the fact that a lot of the money goes either to allowances. So when we talk about 65, we might be assuming the money actually goes to buying of drugs. But we remember the challenges that were even mentioned by the union itself, that its members do not have PPEs, they are treating patients under very strenuous conditions. So then, and you remember that time, even what was being brought in the special audit by the Auditor General's report pointed to some of these issues. So this is a bad one to say, but a lot of what we saw was either they were saying some were on refreshments, issues like that. So we also need to look and even say, it's not enough to say that we are allocating this percentage to the health sector, but to query further which budget lines and what is a priority for us. So I know a key recommendation within that report was that we also need to reduce on allowances as a country. So if you look at those budgets, then there's a lot of money on allowances. But generally, even our Salaries and Remuneration Commission had the national conference on the wage bill conference, and a key issue was the amount of allowances we are paying our state and public officers. That then looks, you would say we are giving this to a sector, but a huge part of that allocation really goes inwards to state and public officers, but not to the taxpayers. And we feel this negatively impacts what we are mentioning, that even when we're talking about universal healthcare, that we want the voluntary, because remember, a lot of Kenyans are in the informal sector. So if NHIF is to collect from them, it should be voluntary collection. But if I was not covered, or the government did not give me healthcare even within the COVID, why would I voluntarily pay the 500 or so that they ought to pay per month? So these are issues that the policy option that government takes, if you focus too much on your state and public officials, then it means you're leaving a significant number, which is around 67% of Kenyans are in the informal sector. So when you're talking about UHC and you're leaving them to be the ones paying, and they're concerned about accountability around that health sector, they will obviously not do it. Yeah,
there's a problem.
You know, when you talk about a report, what immediately comes to my mind is, was the report definitive? Did it break down in details so that you actually know this amount of money went here? Okay, of the total caboodle that was there, this went to snacks, this went to allowances, this went to drugs. Did it break it down to those details? Then it isn't a useful report. Because if you do not know what goes where, how then can you plan to take action so that you can remedy it? What are you remedying? You have a situation where the only thing which is definitive is the budget, the amount. We know. And then you look at what ought to be provided, which is direct healthcare, drugs, PPEs, things that help the process of providing healthcare. And what makes you realize that is insufficient is when you see the lack of proper care being provided, an absence of it, and you're being told we don't have this, we don't have this, and we don't have the other, and it's making our work difficult. So where does one go from here?
As I had indicated first, when we were looking at this, a key aspect of why we commissioned the report was, debt has been an issue that is looked at, and we see it's very abstract. So debt is an issue, very different schools of thought. It's not an issue, we are not in the red. So our concern as an institution for this particular report is there a link between debt and health? And as we've already mentioned in the report, is that it says clearly that in as much as we've continued to acquire and accumulate debt, at the same time, our health budgets have been increasing, which if you look at it at both at that level, you can say, then that's fine. Maybe the debt we are acquiring is being redirected to health. But again, we say that is not the case, because when we bring when you as a country take on debt, there are different sectors that, competing interests. So when we are not increasing the revenue, I think as a country, the problem then is that the revenue is not increasing. So if I am an advocate for the health sector, when I say increase the health budget, it means you're taking away from either agriculture, because we are not increasing the revenue. But the question then, you say that the report might not be useful in terms of remedying the situation. I'd want to disagree, not Please. Entirely, but
I would really like you to disagree, because it will do me good to actually, because if you disagree, then you're providing hope.
Okay, perfect. So in terms of our budget transparency, that is something we've already, as institutions, civil society players, we've already highlighted that some of these details are not open. And rather even getting them, they're all over the place. And so for us as an institution now to address and on what you're mentioning, remedying, we have gotten into a partnership as civil society organizations with the Office of the Controller of Budgets, because this is the office that then has all that detail. So the Ministry of Health received this much. This is how much went to allowances. This is how much went to refreshment, so to speak. And this is what actually went to the citizens. So their report is useful to the extent that it has already mentioned that 65% or so is what then went to health. But now it's someone else to run. And even we as an institution then are running further to say we want to look critically that, hey, we have said health budgets has increased at the same time as we've increased our debt. But now query further, where has it gone? So the first answer we were seeking is this debt improving a key sector? We have found that there is a correlation, but you cannot say 100% because of debt. So a research sometimes and a study, as you say, some of the results might be different from what you set out at the onset. And that gives you a room to then come and say which other question or which other important issue do we want to extract from what we have found from this report. So indeed, just to reiterate, that the report points to the fact that as we've accumulated or increased on our debt accumulation, the health budgets have equally increased. But now we need to query further. That is not a good thing for us to celebrate as a country and to say the health budget has increased. But now where is this being applied?
Let me ask this question. When we talk about the health budget, we are talking about what the Exchequer tell us, money allocated by the government towards health concerns and needs. Is that what we're talking about?
Yes.
Where then do we place the assistance that we receive from friendly nations and people who want to support us, programs that support our health sector? Where do we place this? And how do we look at their significance and their contribution?
So when you're looking at the health budget, then you look at what the country itself, so the whole, let's say, this is what goes to health. You're looking at what our friends have said are giving their grants. So we have, and a huge part of our budget really is also supported by those funders. So there's a little bit from the Kenyan government itself, put that together with what we are getting as commitments and grants from other countries. And then we also have the user fees that if you're looking at the higher level of care, then you as a citizen still pay directly. So all of this is then what comes as the total amount in the health budget. Yes.
I guess now further to that is, okay, so even if we're saying that, because I think I'm assuming that it's looked at from end to end. If the budget has increased on health, then the assumption would be that then you are seeing improved health services and facilities across the country, that you're seeing improved and increased infrastructure, even to areas where it was previously non-existent or that it was failing in terms of capacity. Do we then see that as well? That because the budget has increased, then we are seeing a better health provision around the country. Is that the case?
That's not the case. Probably other people have different experiences. But first, I'll speak about my experience as a user of health facilities, because I try to use the nearest health center next to my place occasionally, just to also, because you cannot come in and just say, we do a research, but have you ever experienced? So my take first is when you go to some of these health facilities, you're spending a lot of time in terms of wait time. So it points to an issue of a staffing issue, which is a consequence then of, either budgets are insufficient. That is not the only thing, because it might also be the training, our training facilities. Are we having enough training facilities to bring in the number of people we want? But now that is personal experience. From the scorecards we undertake, because we as an institution also have a lot of scorecards where we sit with citizens from the different health centers, have focus group discussions. What is your general feeling around service delivery? So it's a bit mixed. So some counties, because remember now it's a devolved, so, and we are more focused sometimes with the primary health care, because that is where also the health practitioners say there's the greatest impact and best use of money if you focus on primary health care.
Right.
So that depends on also how the counties have prioritized. I'm sure the feeling from, say, Makueni, Kisumu,
even Nairobi.
Turkana, Nairobi will be very different. So I would say that citizens need to be the ones who really answer, and that's why we as an institution take a lot of our time to build the capacity of citizens to then say, You are funding this system. Are you getting drugs? So when you go to your county facility and there's no medicine, are you just moving directly to go and buy it from a chemist, or are you asking, why am I paying this tax and I am not getting this service? But one voice obviously is very difficult.
Sure.
So that's why if citizens can mobilize and come together from the ward level and you start calling out your duty bearers, why are we not getting medicine in this facility? I give a case of Nairobi, which for some time had... was it a debt with KEMSA, so to speak? So there was no medicine that was being brought to the facilities. So why would media be the ones first to highlight this, as opposed to the citizens themselves saying, today, maybe for 1 or 2 hours, we are sitting down to have a conversation with our leaders to understand, if I'm paying the parking fee, if I'm a local trader and I'm paying the fees I'm supposed to pay, why is the debt not being paid? At the same time, you're looking from the control of budget reports on huge amounts being spent on travel and issues like that.
We're coming around to 7:30. We're going to take a break and take a look at weather and traffic. But I think here, maybe the question is, then if we're saying building the capacity for citizens to then raise their voices and complain, how exactly should that be done? Am I supposed to be waving placards in the middle of the street? Am I supposed to go to my local MCA? Am I supposed to bring it to Parliament? Do I petition? Do I look for 1-0? What do I do? And I think that's a pertinent question. Tuned to Kenya's biggest conversation. We're in the room this morning with Siti Muga, Wanjiro Gikonyo Ndwoko, and Irene Otieno, who's the national coordinator of the National Taxpayers Association. And we're looking at the impact of debt on the health sector in the country. It's asking the question now and saying, you're saying, if we are seeing that these things are not working, in as much as the health budget has increased, you go to a health facility, you don't get the services that you would want. And we're saying citizens then must speak up. But the question is, you're competing with issues here. When you're looking for a service, you're looking to treat yourself at that time, treat your child, take your child to hospital, get medical attention. You're not necessarily thinking, well, then I must rise up and, join with others and let's do something about this. So how do you deal with the situation in which you are in, that you need medicine today? When you're told that KEMSA has a debt and that's the reason why they've not been able to supply to the counties, that's not your thinking at that point. You're thinking, I need medicine today.
True.
So where do you cross over from the personal issue and graduate to a lobbying issue then where citizens must rise up? How do you draw the line or cross the line?
That's something I think most citizens grapple with. First, when you're unwell and visiting a facility, you do not want to antagonize the system. Of course, you're thinking, I have a baby, and you know that you are there complaining that you do not have medicine. So I have 2 or 3 suggestions and what we have seen working, I guess, in a few of the institutions we've worked with. And I make reference to one facility like Dandora 2 Health Center. In this facility, there were a lot of issues, particularly the maternity services. So a lot of the issues were not raised by the women themselves, but the spouses and the gentlemen within the area. And then you do not, sometimes it's a bit long term, not being reactive that when you're seeking the health services is when you're raising the concerns also. That's a right time to say, hey, I have not found the medication and everything. But you find a plan B, which is unfortunate, but that's what it is. But then after that incident, what happens? Remember, in each and every public facility, there are community members that are already elected or nominated by the community to oversee services within that facility. So my first question would be, me as someone living in, say, Kasarani, do I know the health committee members who are citizens and not government officials or anything, opinion leaders in the area? Do I know them? Because there's a youth representative within that committee. There's a women representative within it, a person living with a disability. At least there is an attempt to have it balanced in the religious entities. So this is a grouping that I think first we as government need to build the capacity. What we found out is they are hardly trained by government. So they are there kind of to rubber stamp. So this is a group that I have seen funders and donors coming to strengthen their capacity and say, you're here, you should oversight and be the voice of your local area people when they are seeking these services and they don't get. So that is one. We've already mentioned they are not trained. So this is an area that needs to be tightened up so that they understand there are budgets that come. Do these people who should oversight even know that there's a budget per facility? Secondly, again, how are they brought on board? the same issues we have in terms of elections we see at national level is what is playing out at these bodies. So you'll find most of them are nominees or appointees of the political class. So then you find they do not have a good linking with the community and then are not good advocates on their behalf. So that's also an issue that we as an institution have said we are before they sit for 3 years and an additional 3 years, so those are 6 years. So these are groupings that we have said when a term is coming to an end, we popularize that, hey, there are local level election stroke nomination for these seats. Would you want to take them on board so that people get to know and have credible people there? Because if you do not have credible people there, they're also part of the people that whatever limited resources come to the facility, this is also siphoned. So if you can tighten that and not leave it to you as an individual person seeking healthcare trying to raise your voice, it's a bit problematic when you look at it that way. But that doesn't stop you as an individual. We have seen very vocal people moving and saying, hey, this facility has to be closed until this is addressed. You cannot have a facility that's saying it's a 24-hour facility, or even if it's one that opens at 8, you then find that the staff are coming in at 10 or 11. So if you're a person seeking medical, you've been there from 8, these people come at 11 and many other things. So for me is the fact that citizens just have to realize that it is you funding. I think if there's that realization, personally for me, it helps me start making a bit of noise. So I don't know whether for other citizens it doesn't, but when you look at your payslip, particularly if you're in formal employment, why would they take a whole 30%, which is huge, but you take care of your health services and any other issue? So the least you could do is ask, hey, why is there no medicine, and try to take action. So what I would say is citizens are also partly to blame for this lack of accountability. I wouldn't take it from them. Because in your own house, if there's something wrong, you don't wait for someone else to raise it. No, I've employed someone in my house, then I need to make demands. You must make time. No one has time. So I need to give, I think I just like giving that example of myself. I was seriously going to work. So say, let me drop the baby at the health center. Then I know I'll make time to go to work. I know it would be an hour, I should be done. These guys were coming in at around 11. So I had to ask, no, I want to speak with the manager of the institution. Obviously, they did not take it kindly, moved it to the sub-county official, and at least it didn't bring an immediate result, but I felt I had done my part. So if a lot of us do this, but most of us would be sure, like, no, I have only an hour, I need to go back to, so let me move to the pharmacy. But if all of us do this, the resources that should come to you are essentially not coming to you. So citizens are not running away from this. I think a lot of it has been on politicians, but citizens must add their voice to
You know why? Have you asked yourself why it is that citizens don't rise up and perhaps raise their voices a little more?
No, I have, but I'm also interested to find it from your own perspective.
You see, when we talk about politicians and we talk about, say, a devolved service like, say, health, you are talking about representatives whom the community can relate to very directly. This is not somebody in Nairobi. This is somebody you know. You even know where they live.
Yes.
So you went to school with them. Your children went to school with them, whatever the case may be. But the issue that we are dealing with here, at some level, we normally say the mother of the problems is impunity. But the real problem, the father of the mother, is how we've institutionalized it so that at every level, we ourselves participate in it. So if the MCA is my friend or is my cousin or is my nephew and they're involved in something nefarious, I'm very unlikely to speak because I know I may benefit from his ill-gotten gains. Okay. When you go to a public health facility, if next door to it there is a private health facility, people trained in the same institutions, offering the same service, why do you think in the private institution you likely find people doing what they're supposed to do at the time they're supposed to do? Why? It's because the laxity you see in the public service is allowed to thrive. Okay? It with time then becomes just part and parcel of the culture of the place. And people tell you, this is how we do things here. And throughout our government services, something you hear very often. This is how we do things here. It takes it even further. A new broom comes and you're told, you, with these new fangled ideas you brought here, you found us here.
You still leave us
here.
Can I take a slightly different view?
Please.
While agreeing that as citizens, we opt out. If you can afford it, you opt out of the public system, you go into the private. For those who are in the public, we don't complain enough. I will take a slightly more optimistic view that things
Are
are
you
changing.
suggesting that my view was not optimistic?
yours is very pessimistic because I think there are pockets of change, and I liked what Irene said, looking at examples where public services have improved, and you gave an example, and there are many others. And the question is to ask, why did those manage to change? Why are those health committees more active? And I really liked what you said, that Kenyans might not complain directly because maybe we've taken this Western model of accountability and we expect citizens to get incensed, but maybe that's really not our culture. But to work within the community, because the health committee is part of the community. So you're more likely to go and report to them after the fact because we have a high tolerance level. But the optimism I was going to give is this. What this report is telling us is that government has overborrowed. We are not happy with that. But some of that money has come into the health sector. That is good in the first instance. The question is, where has it gone? Because there then seems to be a misalignment with the funds are not following the functions because the function is at county, but the funds are at national. So really what this report is telling us that county governments need to be involved in the debt conversation. So this report is useful. I think the second thing that I would...
When you say involved how exactly?
Debt is procured by the national government without the voice of the county governments.
And where would their voice fit in?
Under the Constitution, there's supposed to be intergovernmental mechanisms. There exists the Intergovernmental Budget and Economic Council, IBEC, which is chaired by the DP at present. And so, in fact, I saw there was an IBEC meeting.
It is always chaired
and
by the
state
DP.
officers were saying they are not attending. Even the CSA attorney was saying he's not attending, he'll send somebody. So, unfortunately, there's a lot of politics. But IBEC should be part of the debt conversations. In which way? How much is coming? Where is it going? So the challenge really is on county governments to make sure they get their voice. The other missing link in the debt conversation is the citizens, because this debt just finds us. From a public participation point of view, by the way, and there's a case in court about lack of public participation in the national budget process. You don't have the opportunity to give your input around debt because the first stage of the budget making process at the national level is very closed.
But Wanjiro,
Yeah.
if I may dampen your spirit just a little bit
Yes.
with my negativity,
So, yeah.
I'm looking at a certain growth industry in this country. It's a sport. The plunder of national resources at the national level, and at the county level, it seems to be an accepted practice that funds within the county level are fair game. I mean, I wouldn't know where to start when I look at the issues that the Ethics and Anti-Corruption Commission bring up, the Auditor General bring up. There are so many.
Agreed.
So that the entire conversation about financing, budgeting debts within our institutions, they all revolve around an understanding, it appears, with the people who work there, that this thing is fair game and it's open for plunder.
I totally agree with you.
So that every other discussion you have in between here is just an academic exercise, where we have. So as
the
not,
bottom line
so as not to be a
is-
complete
is-
wet blanket.
Right. Just
and I'm with
partially.
you there, by the way.
Yes.
The bottom line is, where is the money going and who is it benefiting? Because Irene also told us the problem is revenue is not increasing. Kenya has not even reached the 15% financing of health that's required. I think we're at maybe 8 or 9%.
We're very far from it. Even if it's above half, above half for health activities is very low.
So it's increasing, but who is benefiting? Where is the
Exactly.
money going?
The-
Because
No.
we know
the
there is
details.
medical equipment scandal. Which other health scandal?
Let me give you a live
level,
example
cancer
of what we're
Hammer is
discussing
asking
so
me.
that you understand that even
Yes.
as we talk about the private sector, I worked in the HIV care and treatment space for a long time, a decade and a half and beyond. Okay? Now, you found two models of partnerships. Those who are what you call standalone, they get funding to provide care and treatment, preventative, the whole spectrum of it. But they have their own shop somewhere, they have their own offices somewhere. It's called standalone. Then there are those who integrated their services within the existing government structures. So if they were putting up a comprehensive care center, it was within the structure of government. Whatever they were doing was within the structure of government. If they were providing services, again, it wasn't standalone. It was within existing government health facilities. Now, what this meant was that whatever funding they were getting would directly be infused into the health system that the government already had. Okay? Now, one easily saw the direct results in terms of the lasting effects of it. Meaning, funding always comes to an end. So when funding came to an end, it was very easy to determine who of these groups was going to have had a more lasting effect. on the other. Okay? Now, then came the problem of dependency. PEPFAR provided a great deal of help. Now, the thing about PEPFAR funding was that it wasn't care and treatment meant every opportunistic disease known to man and unknown would be catered for. So within the public sector, what this meant was diseases had care taken care of, meaning that support was completely comprehensive. So you could find a health facility functioning extremely well. If you have a cough, the medicine will be there. If you have an itch, the medicine for the itch will be there, meaning it was catered for. We had it to the point where even blood services and everything around it was donor funded. Now, why do I talk of dependency? Funding, and those who fund you tell you in advance.
Yes.
You know, on this date, we're going to reduce it. They tell you. There's no surprise about it. And yet we found, for instance, blood donor service in this country coming to a halt simply because people are dependent. Thinking went out of the window and they were waiting for somebody else to come and do it for them.
People are these.
Precisely. It is not easy to understand. It is easier to understand if you break down what these monies we speak of and what they would represent. For instance, when we talk about 1 million shillings, no, let's bring a small amount. When we talk about 10,000 shillings in a health center, what it means is X boxes of Panadol, which each has 1,000. When we say 20,000, it means X bandages. When we say this, meaning so that when someone talks to you about an amount, you can immediately see why
What
it
it
is
could
you
do.
don't have what you have, because the guy has, that person has literally taken those bandages. They've literally taken the anesthesia.
Yes.
They've literally taken the antibiotics. That's what they have done.
And so you pay twice.
Yes. So the disconnect, we don't usually connect this directly. When you talk about schools that should be built, when you talk about the money, this amount represents a brick. This one represents a wall. So when you're told the school doesn't have enough classrooms, this person took 20,000 shillings. This is what it means to you.
There has to be a direct correlation
Yes.
between this money that is missing and what it could actually then provide for people. Void of that, you're talking in space.
So in other words,
Yeah.
the data in this report will not spur citizens to action.
No, it won't.
can't.
It is
What am I
good
doing with
data,
it?
Yes.
but is now taking it and giving it life.
Yeah. Linking it to the cost to the citizen.
Agreed to some extent, that we need to look at the audiences we want to have this conversation with. So a first audience for me of this report and a user of this would be first what we have said, the devolved unit, the Senate and the Council of Governors Health Committee. So that they understand if you do not add your voice on issues of debt, you're missing a fundamental funding that would support your devolved system. But then further, as we are saying, then pick and say, unpack kind of. So the 65% that is there, where is it going to? So I have those details, and then what does this mean for citizens? But I still feel that even if you were to get the entire 65% being utilized very well, it will still not be able to provide sufficient healthcare to citizens. So then that means the amount of funding still to the health sector needs to improve. And the amount that is given per health center by government is very limited, similar to what government is giving per child for FPE. So my concern as an institution, I guess, is government taking care of itself more than citizens. Look at how much government gives in allowances. I keep saying, a day, if you look at the Auditor General's report, if I'm going for a trip for a week, it goes to $1 million. But you not give $1 million to a school which has how many students? So the capitation per child would go to around 300. I lose the number, but it's not more than 5,000.
You've now connected it. You see,
I think that is another problem.
You see, you've connected it. I think I spoke a bit out of turn when I referred to the report as not being very useful. No, I take back my words.
Yes.
All of it. The report is extremely useful. You know why? It provides the ammunition with which you can now go into the details and get granular on what you're saying, because you provided whatever the structure that is required to launch this thing. I've taken back those words.
That is fine, but we still need to apologize further than that. But not for us looking later.
I thought you were going to take that and run with it.
No, he doesn't know you, and then you don't know her.
I know.
Things have changed.
No,
Gender.
but honestly, I think what government is doing, what they give to citizens becomes too little. It will never give a child capitation more than 5,000. Per facility, if you look what they are giving per facility per quarter, it hardly pays for the guards, the watchmen, the cooks, but what they give to themselves. So I think that conversation as a country, we need to kind
it
of
needs
just
to be had.
Yeah,
that's
to balance. And you say you cannot take care of a few people, because remember, we are already saying that the wage bill is very high as a country, and that's what is eating into what would go to services. So even if we were to advocate and we are saying the revenue is not increasing as we would like as a country, so then it means we need to improve efficiency within what we have. So how do we improve efficiency within this 65? Agree as a country, and I think I hear Shiro talking a lot about the fiscal consolidation. Even if you look at that fiscal consolidation, it does not mention reducing the pampering of our state and public, but it will talk about do this to the universities, do this to the institutions that a lot of people rely on, but none to this small clique of individuals. I think the first time when you're talking about fiscal consolidation then would be to tell us, how are you reducing expenditure that is just not travel, meals and everything? The allowances is a huge component. Then you would be able to free resources, because as we are talking about our social accountability that we undertake as an institution, the frustration is that we point to the same issues. Wait time is high. There is no medicine. So in terms of the solution is only let us have more resources, but where are you getting the resources when you don't want to accumulate debt?
Exactly.
So then we are saying reduce things that kind of take care of 2 or 3 people. And allow me, time is not there.
We're going on this, but I have to say, we cannot overemphasize the importance of continuing to have these conversations. So at this point, unfortunately, time has run out. However, we have to say thank you, Irene Otieno, National Coordinator for the National Taxpayers Association. Thank you for joining us this morning. Pertinent issues. And like I said, to continue talking about them perhaps is the antidote to this. Somebody's bound to, at some point, sit up and take notice. Asante Sana for joining us. Hopefully we can talk to you again and to on this discourse in good time.